Hi, and welcome to the Future of Dermatology podcast. I'm your host, Dr. Farah Kamangar, board certified dermatologist. We are here to talk about anything and everything dermatology related. You'll hear from me and my guests who are dermatologists, physicians, experts, scientists, residents, and medical students in the field of dermatology. We publish weekly, so if you like what you hear, hit that subscribe button and show us some love, and thank you for joining us. Welcome back. I am so excited for today's episode. We have Dr. Mary Alice Mina, who's doing everything and doing it so well. So I'm so happy to have her here. She is a Harvard-trained, double board certified dermatologist, dermatologic surgeon, and she's a leading expert on skin health and skincare. She's the host of The Skin Reel, a podcast for people looking for real skincare guidance by true skin experts, where she emphasizes a holistic, preventative, and regenerative approach to skin health and aesthetics. With over 15 years of clinical experience, she's an invited speaker on podcasts, national meetings. She's recognized for having an artistic eye and surgical skills while helping people feel good in their skin. She's the co-owner of Baucom and Mina Derm Surgery in Atlanta, Georgia, and she treats patients with advanced surgical and cosmetic procedures to restore and maintain healthy skin. And you do it all so beautifully and so seamlessly. And I love to watch everything that you put out through your podcast and social media sites. So thank you for joining us today.
Oh gosh, thank you for having me. And coming from you, I feel like, boy, you're wearing a lot of hats too. But you know what? I think that's just the kind of people we are, right? We want more and more, and we want to just challenge ourselves, and we love to teach, right? So this is teaching in 2024, is putting yourself out there on social media and podcast and speaking.
Yeah, absolutely. Actually, starting with that, I would love to just hear about your transition from, because you work so much and you're doing such complex cases, and then you're making time to teach on social media as well. And I talk about this with many of our physician colleagues. It's not necessarily comfortable for most of us, but some are doing it really, really well. And you're one of those individuals that are out there, and you're not only able to keep up the pace of life and clinic and actually putting content out there, but then you're also doing it really well, and it's educational and it's entertaining. I'd love to hear that story of just making that transition, and if it was easy, or if you also found it a little bit of a vulnerable thing to do. Or
Oh gosh, yes, absolutely. So I love my practice. I love taking care of patients and doing clinical medicine. And I thought I'd kind of just do that for the rest of my life. But during COVID really was a wake up call for me, because I was at home. I wasn't seeing patients that often. My partner and I were splitting so that if one of us got sick, the other could still work. And had more time on my hands, and was thinking, okay, it really was a stark wake up call for me that if I'm not in my office seeing patients, then I'm not providing care, and I'm not being a doctor in the way that I thought I should be a doctor. And I started listening to podcasts myself, and I really was getting a lot of value and education from these podcasts. And I started realizing there's this whole community of physician entrepreneurs out there. And I had always sort of thought being on social media or putting yourself out there as a physician was a little bit maybe sleazy, or not really what you should do. And kind of, at least when I was training, it almost felt like, you shouldn't do that. We were discouraged from doing that. But it seemed like nowadays, 15 years later, actually there are great physicians putting great messages out there and education information. And so it really was a wake up call for me, like, well, wait a minute, these people are doing it, and they're doing a really good job, and they're providing really solid information. So I thought, you know what if I started a podcast on skin health? And you've probably seen this too. And I don't know if you get frustrated when you're scrolling, or you see really bad misinformation about skin health out there. It's so prominent. And I feel like there's so many gimmicks and hypes. And so I thought, I want to just put out really good information for people. I know it's hard to see a dermatologist. I was turning 40 as well, and I had questions. My friends were coming to me with questions about what's going on. And I thought, this is a great way to give people information for free without having to go and see an actual dermatologist, because there's just not enough of us out there. And the way our healthcare system is run, we don't have these long visits where we can really delve into preventative skincare habits and holistic measures and all these other things that help with healthy skin. So I've really enjoyed it. It's been about 2 years now, and it's been a lot of fun. And I find I learn from interviewing my guests. So it's like a win-win. So I'm enjoying it a lot. So to me, it's not work. It's fun. I look forward to my interviews at the end of the day. So I don't know. What are your thoughts on it? How have you enjoyed it?
Oh, I completely agree with you 100%. I mean, all of it. I think I think we all felt initially very adverse to social media and being on there. And then so there's all the things with physicians about HIPAA and don't put anything out there. So there's that aspect. Then there's that whole professional weirdly judgment that we have of each other in a good way. But, so when you're in a community, you don't want to be doing anything that is jeopardizing your primary work when you go to conferences and things like that. But as you say, when we see other colleagues doing it, it just kind of makes it normalized and it makes it okay. And then I think we're starting to write the rules of how to do it, because we're a group of people who really have a lot of professionalism, ethics, and so much that goes into it. So when you're starting to do something outside the normal clinic, we don't have any written rules for it yet. But I'm sure more of these things would kind of come down the line too. And over time, we realize, exactly like you said too, a lot of our patients are on social media. Even though we weren't there as physicians, they were there and they were getting their messaging from anyone and everyone who goes out. And I think doctors, we need a lot of evidence. So we say like, well, this might work or this might not work. So it kind of makes us sound like maybe we don't know about a topic, where someone who doesn't know a lot will come on and be like, I know what's going to fix this. And it's
I've got the cure.
I've got the cure. And then people listen to that. So I think it's so amazing now that the MD voices are coming in and hopefully diluting a little bit of that misinformation.
Yeah. Yeah, it's just the reality. There. This is how people get their information nowadays. And I laugh. I sort of I don't really watch TV. But someone was asking me, did you watch the Olympics? I'm like, well, I haven't really watched the Olympics, but I've watched the reels.
Yes.
That's where I find out what's going on the reels. It's funny. And it's really all ages are doing this. You might think, oh, it's just like Gen Z or millennials, but really people of all ages, maybe they're on Facebook and not TikTok, but they're on social media and they're looking at information there. So, but to your point too, I think I'm a pretty outgoing person, but yes, it was nerve-wracking putting myself out there. And I'll tell you, I was okay with speaking to the world and strangers, but I didn't want to tell, my business partner or my close friends and family. Like I was like nervous to tell them because I didn't want them to think, oh, I'm a sellout, or, being a doctor's not enough for you. Or why do you feel the need to have to do this? Or you know more than everyone else. You don't want to come off like that. So it was funny how I was okay sharing with the world, but I was intimidated to tell my immediate circle. Because I didn't know how they would respond to it. But I mean, so far the response has been wonderful and great. And, it's been a lot of fun.
Yeah, absolutely. It's definitely a vulnerable place to be. So it takes a lot of courage to go through that. And you're so great at it too. So that's probably been amazing just to see the positive feedback and all the learning that everyone's doing from your podcast. And that's the other thing too. So how do you kind of pick topics to pick on? Or I know you mentioned in the 40s now and looking into, as am I. So it changes your mindset for sure. You're like, okay, we got to get down to business now. In your 20s and 30s, you can kind of get away with slacking. It's all fun and games. And then it's not.
Exactly.
It's like for me, I would say that definitely in the 40s, I would definitely realize the whole thing about the whole fasting and intermittent fasting and all this stuff, and just women not eating and not getting nutrition, not getting protein. We know that we learn about that in med school. We know that we are always telling our patients to be healthy and the portions they should be eating, but you don't really live it till you start to actually losing that body composition. So biomodulation has become a very different thing for me now. I'm curious, how are you approaching that, and what topics are you talking about in your podcast?
Yeah, well, just kind of answer the first question, sort of selfishly, the questions that usually it's things I have questions on or curious about, or, oh, I want to learn more about vitamin C. Do I really need to add it? Or let's talk about retinoids. But I feel like in dermatology, I never have a lack of things to talk about. A lot of it is what my patients ask me or my friends would say, do I really need this? Do LED mask really work? Do I need to start doing gua sha? They'll ask me
Yeah.
these questions or, what's a skin cancer? Oh, I've never heard of squamous cell. What is that? So I try to do common things that either I have questions about or my friends and family or my patients, or things I'm interested in, or kind of like hot topics like, oh, is that really helpful or useful? Or, when benzene was found in personal beauty products, I wanted to talk about that. So trying to just stay relevant with things that people ask me and, things that I'm going through. Yeah. So like you said, I'm now 44. Those numbers it just keeps going faster. But, I feel like your 20s and 30s, my goal in my 20s was really to be thin and pretty. And then my goal in my 30s was like having babies. And I didn't really have time to focus on other things. And then now in my 40s, what I'm realizing, the biggest thing I've realized is that skincare is so much more than just what you put on your skin and sun protection. I mean, those are huge. And I think we knew that from residency and everything. But what I didn't realize is I wasn't taking care of my body. I was really not prioritizing exercise, which is still something I need to be better about. I was doing all cardio, never lifting weights because I did not want to be bulky.
Yeah.
I had been a vegetarian, then a pescatarian in med school since I was 16. So that was a long time, like 27 years of not eating meat at all. And I all of a sudden realized I was hungry. I was craving meat and I was eating a lot of fake meat to satisfy that craving. And I thought to myself, like, is it really better for me to eat fake meat or just eat grass-fed beef or humanely raised chicken? And so I did start to eat meat earlier this year just because I felt my body, I've never craved protein like that before. And I just felt like that was my body telling me we need more protein. And as we've learned, that's so important, especially as we age, especially as middle-aged women, to have that protein, especially animal protein, is key. And just take, I feel like busy people, professionals, but also in medicine, it's really, this like go mentality, sleep's not important, not prioritizing your own care. And I've really had this wake up call that I need to take care of myself. I need to take care of my mind. I need to take care of my emotional well-being, and I need to take care of my physical well-being, because that's like the foundation for being healthy. And now my priority is not so much thin and pretty. I want to be healthy and strong, and I want to have vitality. So it's shifted for me in that way.
Yeah. Yeah. It's such a good point too. Within medicine, we have such a mentality of like, go. And like, you might even just start clinic and keep going, not even eat breakfast, not eat lunch.
Yeah.
And just, that was like a thing that you get used to. Or we were in the hospital on like 16-hour shifts or 30-hour shifts, and you'd forget the last time you've eaten or slept. And weirdly enough, it creates this culture, even though we're supposed to be promoting health, it creates this really unhealthy culture of not sleeping, not eating right, stressed to like the max, even though we think we're not, but I'm sure like medical school residency, we were, right? Like they have
Totally.
5 pagers going off. And then, and you get to the clinic and all these different things. And then doctors wonder why they get a little bit burnt out. And there's all of course, the sides of healthcare we could speak on too. But when it comes down to just literally our physical bodies, you haven't taken care of it in your 20s or 30s because you've been running around training and starting a practice and all of that. So, and you touch on a really good point too with just getting protein intake. That's one thing I stress a lot with my patients, especially when they come in for procedures. Even with the hair loss or for doing lasers, you need the nutrition around to get the effects that you want. Kind of similar to like people who are exercising. If they're doing it on an empty stomach and never eating, you can't, do any of the biomodulation and grow muscle or grow collagen or.
I had no idea it was so important, right? Like, I mean, I thought I was healthy by eating like whole grains. And I think in general, I would try to eat more healthily. But yeah, I mean, I definitely have a sweet tooth too. But yeah, I didn't realize how much, and I still struggle to get the full amount of protein I probably need every day. I mean, it's a challenge. You really have to work at it.
No, absolutely. It's definitely, it's a hard thing to do. And I love the move to a little bit more from the superficial, like just creams and sunscreens and all of that, to just being more holistically healthy, which is, I think, another thing that MDs can offer on social media and these platforms versus, all the just skincare ads and things like that. And I'm curious, speaking of skincare, where do you see things going? What trends are you seeing? It's just changed so much, I think, over the last
Yeah.
5, 10 years. Like I feel like every day my patients will ask me something and I'm like, let me look that up. Like a new
Right.
thing popping up.
Yeah, it's hard to
Where do
keep
you see
up.
this world going? Yeah.
Gosh, well, the whole like beauty industry and everything. I mean, it's like a multi-billion-dollar industry, and projections show it's not slowing down. But what I would like, and sort of what's guiding me, is instead of thinking about anti-aging, thinking about pro-aging and looking at aging in a sort of preventative and more holistic way that I'm not trying to look 20, but I want to look the best that I can for where I am. And so what are the things I can do now so that I do look my best in 20 years? But I think we're at a really cool point in medicine and in history because there's so many cool things coming out. I really think things like exosomes are going to
Yeah.
be very cool. I had someone on my podcast talking about it that, we have things like regenerative procedures like PRP, and things like biostimulants, which I'm a big fan of those. But I think sort of the next step is exosomes. And exosomes in and of themselves are just little envelopes. So it's important. What's the message that's in those little envelopes? So I don't think it's been teased out just yet. I know that there are some products that are now being promoted with exosomes. But I think if we can signal a message to help fight a skin cancer on the skin and put a cream on, that's amazing. Could we put a cream with exosomes on a burn and help it heal into normal, healthy skin again? And then, of course, the anti-aging or reversing aging, removing senescent cells. But I think we're going to be taking a more proactive approach to aging rather than just right now. It's very reactive. It's like,
Right.
cut the wrinkly skin off and, fill this. And sometimes it can lead to, not as natural looking results. But if we can really get to why our cells are no longer regenerating and get rid of sort of these senescent cells that are just hanging around and not helping out and making our skin old, like if we can help with that, I think that's a really cool area. And I don't think it's all that far off. So, and then of course,
Yeah.
like stem cells, right? I think we'll be seeing a lot more stem cell therapy, not just in dermatology, but in a lot of different areas.
Yeah, absolutely. The regenerative medicine coming out is so exciting, and it's such a new take than what we've been doing. Speaking
Yeah.
of the more proactive methods, so as a Mohs surgeon, you treat a lot of skin cancers, and I'm sure many of them are super advanced and really bad. So you see firsthand the importance of sun protection
Yeah.
and sunscreen. So another trend we're seeing a lot is people kind of fighting sunscreen. I mean, it's been going on for a long time, but there's a little bit, I feel like it's picked up again as
Yeah.
of recent for, whatever reasons. There's people making sunscreen at home. Then there's people saying, don't use this, don't use that. What is your general guidance? And like when your patients come into your clinic and ask you things they've heard?
Yeah, no, it does make me really sad because I see my patients in clinic who are coming in. I mean, sometimes they come in so often. They'll tell me this is my 100th skin cancer. I mean, that's crazy, right?
Wow.
And always the older patients will tell me we just didn't know. Back in my day, we just didn't know. And so the fact that
Yeah.
now we do know and people are fighting it so much, it does make me it does make me sad. But I guess, again, that's why I'm trying to put my message
Yeah.
out there that sun protection is key for preventing skin cancers and for, photo aging. And those are the facts. I mean, it's there. And if you're worried about certain types of sunscreens, then you can stick with zinc or titanium. And I'm also a big fan. I mean, I know this sounds crazy, but I don't really love putting sunscreen on. Like, I'm not the best at reapplying. So I always have a hat with me. I always sit in the
Yeah.
shade. So I still enjoy being outdoors. I still enjoy doing things, but I will wear like a rash guard when I go swimming at the beach, and I have my hat on, and I just try to make good choices with what I'm wearing and shade and sunglasses and hats and things like that. So that's also a component of sun protection. It's more than just sunscreen. But yeah, I mean, I would just encourage anyone listening is who's giving you your information, right? Is it a celebrity who really knows nothing about skincare, but has a lot of money and really unlimited resources so they can kind of fix whatever problems they cause? Or is it someone who has really dedicated their life to studying and learning about the skin? Just make sure who are you trusting? Also, what are they selling, right? Are they telling you all sunscreens are bad, but you can buy mine for $19.99 and it's safe? So you just have to be careful about that. And nowadays, I guess in a way, it's great. We're so connected, and a lot of people can share their knowledge and have a loud voice out there. But then the negative is that, we can't really patrol who gets the loud voice, who gets the megaphone, and the message they're promoting is not always valid. So I would just encourage people to look at who's giving you the information. And I would say, trust science, trust what the data shows.
Yeah, that's great advice. And I would say trust what the Mohs surgeons are saying. Our skin cancer surgeons see it all. So if they're telling you to block from sun, just do it. And I love that you're normalizing just not everyone's going to, because the other end of it is people who are like on the beach and they have the photo and they're like covered in a full suit. And that's not normal either. Most of us live in the middle. So I love you normalizing that, you know what, maybe I'm out with my kids. Maybe I just didn't have time to reapply 4 times, even though we should be doing it. There's things we should be doing than things we actually do in real life. So just normalizing that we're all trying our best, but that doesn't mean that the message should be lost that somehow we shouldn't protect from the sun.
Yeah. And you don't have to be afraid of the sun. I like the sun. It makes me feel good when I see the sun out there, but I have very pale skin. So I burn incredibly easily versus my husband has darker skin. And so he can handle it more. So you also have to know your skin. And I just wish people would take it more seriously. I always say, put me out of a job, let me retire and early. But unfortunately right now, really the best treatment is cutting it out, especially for the more advanced ones, invasive ones. And I'm hopeful that in the future we'll have other modalities, again, maybe some sort of cream that can fix the mutations in the skin or some other modalities to help treat it, because it really does fatigue patients to have to be cut on time and time again. And these are usually cosmetically sensitive areas like your face, your ears, your nose, your hands. And even though we can do amazing closures and amazing work, eventually when we're working on your 100th one, it's challenging.
It's a lot. Now I have patients too where we might find another small basal cell and we're like, oh, it's just a basal cell, a send to our Mohs. And you just kind of see them kind of sink into their seat and you realize, well, maybe that's the second or third they've had in the last couple of years. So they've been to a Mohs surgeon, had a surgical operation. Even though for us, it's no, we caught it super small. This will be an easy thing. It's really hard. It's hard for patients to have. And then they also think, is this just going to keep happening? And we see it every day. So it's not a good place to be. So I think prevention is key. Or the patients where we have we're kind of cutting out a melanoma, and as you're cutting out the melanoma, you look next to it and they're like, is there another one just starting right now, as we speak? So I think we see the end stages of when people have had so much sun over decades, and it's not good. That's the main message.
I'm seeing them younger and younger. So it used to be I never saw patients really younger than me. Now, yes, now I'm 12 to 15 years older, but nonetheless, I'm seeing people much more common in their 30s. So I feel like I'm seeing younger. And the other thing that really surprises me, maybe you experience this too, is even though skin cancers are the most common, more than, basal cell carcinomas and squamous cell carcinomas, people don't, I was just talking with some friends the other day, have never heard of these, or they don't realize squamous cell carcinomas actually kill more people than melanomas, yet most people have never heard of it. So
Yeah.
I think, again, we need to do a better job letting people know that there are these types of skin cancers out there. It's not just melanoma. And in fact, these other ones are more common and potentially more deadly. Now, most patients do really well with them, but there's still this like fatigue of constantly having to be cut on or having procedures and rubbing a cream on your skin for 6 weeks that's red and crusty.
Yeah.
That's not fun either. So
Yeah.
I think we need to get the message out there about these squamous cells and basal cells that, even though they may not kill you, there are other issues associated with it. And, you don't want to be having one of these every year for the rest of your life.
Yeah, absolutely. Those are such great points. And then lastly, I've asked a lot about everything you do in podcasts, social media, but I would love to hear about your daily practice as well. So you, of course, do Mohs and also lots of cosmetic procedures. What is kind of the makeup of the majority of the things that you do on a day in, day out basis? And then also sometimes we have residents who listen. Any general advice about going into private practice and benefits of that? I know those are large topics, but would love to kind of hear your thoughts on that as well.
Yeah, so I feel super blessed. I did my fellowship in Atlanta, and my business partner, Dr. Baucom, would be volunteer faculty at the VA, and he would come out once a month. I'd get to sort of see how he would be the attending in charge, and I would get to work with him. And then he would frequently, for these vets, if they didn't have Mohs at the time at the VA, so if it was a big case that needed Mohs, he would say, we're going to come do it in my office. It's going to be a charity case, and you're going to come be the lead surgeon on it. And so I spent a lot of time in his office, and I just thought, wow, I mean, he's a great surgeon. We're doing all this amazing charity work for our vets. And I just really loved how he ran his practice. And I was fortunate to be able to join him. And that's been great because he's ahead of me by about 15 years, and it's been a great mentorship. But we're really a referral-based practice for procedural dermatology. So the bulk of our practice is Mohs surgery, taking care of skin cancer patients. We tend to do that sort of in the morning, but I also joke we're like Dr. Pimple Popper in Atlanta, and so we do a lot of cyst and lipoma removals, and we do what's called tumescent anesthesia. So we can numb up large areas with lidocaine much more than you can with those little needles that we use for biopsies and things like that. So, I mean, we can remove incredibly large lipomas on people without having to put them to sleep, without general anesthesia. And that's very satisfying and really gratifying to be able to help patients with these large lesions that they have. So we do a lot of that. And we do a lot of cosmetic procedures of fillers, injectables, things like that. But we also do more procedural things or surgical things like blepharoplasty, so upper eyelid surgeries. We have an Ellacor machine. We do a lot of chemical peels, microneedling. I'm a big fan of biostimulants. Those I find really gratifying, and trying to think what else we do. But
that's fantastic.
Yeah, so it's a lot of fun. It's all procedural based, but it's nice to see the breadth of, we do serious skin cancers, and then a lot of times those patients become our cosmetic patients because they're pleased with how the scar turned out, or, while they're here getting their basal cell treated, they're like, well, wait a minute, I also have this bump under my skin. Can you take that out for me?
Oh, absolutely. Yeah. And I think it's so funny, the kind of arbitrary delineation between what insurance covers. And it's like this is a medical patient. And then what becomes cash pay, even though we have our patients that want to do all of these things with us, and they don't always understand the system. So they might be asking for something, and we're like, but you're here for this. And this just kind of, because all of our patients are on that spectrum, they want all of these things done. And then there's this sort of like, well, this is what we've decided is dictated under medical versus. So
why is acne treatment covered but not the scarring of acne, right?
Yes. But
it can be silly.
Absolutely. So it's a whole thing. So we have the same and when you're a dermatologist, you're just going back between medical and cosmetic all day.
Yeah.
Basically.
Yeah.
Sometimes it can be challenging actually in a way too, because you have to help the patient navigate that whole system. But but it is really great.
Yeah, there's such an overlap, yeah, with all of that. But yeah, we also are just, it's nice that we have a very collaborative community in Atlanta. So I know like my colleagues, maybe they don't like to do eyelid biopsies. So
Yeah.
they'll send me an eyelid biopsy, or like today I had a nail biopsy on a woman. So, just like things that we do more commonly that your general derm may not feel as comfortable doing
Yeah.
because they don't see it as often. But you had also asked me about residents and things like that. And that's one of the things I love about our practice is that we have close ties with the local medical schools here and the fellowships and residency. And so frequently I encourage them all to like come shadow with us, come spend the day with us. If they've got someone that they really think would be a great candidate for a blepharoplasty, we'll say, okay, bring him in and we'll supervise and you do it and we'll teach you. And so it's a lot of fun to kind of give back because I was in their shoes not all that long ago. And now I get to be the one supervising. But yeah, I would say for all the residents out there or fellows, like try to find someone who you can shadow and see. Because when you're in academics, I had never really known what private practice was like other than my time during fellowship. So go spend the day, go spend some time with some private practice doctors and get to see what their day is like, because it can be really different from academics. And I think it's eye-opening to see there are pluses and minuses to both. In a way, I always thought I would do academics, but I feel like I've now found this like perfect blend where I can still teach and work with residents, but I have my own practice. And so it's absolutely possible to do both of those. But yeah, I mean, private practice has its own challenges, unique challenges. But if you enjoy sort of taking that leadership role and sort of being the captain of the ship and getting to sort of decide how you do things or your practice does things, then I think private practice is a great option.
That's fantastic. Well, we've learned so much from you. You are so great. And we always, although we've been talking about the future a lot, but it's the Future of Derm podcast. So we always finish out with the last question of what are you most excited about for the future of dermatology?
Oh gosh. What am I most excited about? I just think we're going to see this explosion in, first of all, like the whole treatments of melanoma in the last 10, 15 years, right? With immunotherapy has been amazing. And I'm excited to see our management of squamous cell carcinomas evolve. I feel like we're a little behind melanomas with that and with treatments. So I am looking forward to maybe some new drugs and just to have sort of a more uniform staging and treatment protocols for those more advanced squamous cells. And I'm excited for more potential stem cell exosome therapy, more treatments that we can do to really keep our skin youthful and vibrant without necessarily some of the modalities we have now that can sometimes leave us not really looking like ourselves. So I think it's a really exciting time. And yeah, I'm excited to see where the next 15 years take me.
Absolutely. Yeah, there's a lot of great things happening in dermatology. Well, thank you again. Thank you so much for joining us and teaching us all of your wisdom and all the amazing things that you do.
Oh, it's a lot of fun. I loved it. And thanks for having me.
Thank you for listening to the Future of Dermatology podcast. Remember to hit that subscribe button and share the podcast with your friends. The more you share and subscribe, the more we'll be able to grow and share our dermatology knowledge. If you have burning dermatology questions, feel free to leave them in the comment below and we would love to address them in a future episode. And please note that this podcast is not intended to substitute for medical advice from your doctor.